Have you ever wondered what really happens if you drink milk every day after the age of 60? Many people think milk is always healthy after all. It's packed with calcium, protein, and vitamins. But when your body crosses 60, your digestion, hormones, and nutrient needs start to change. What was good for you at the 20th or the 30th of May not be the same at 60 or 70. So the real question is not whether milk is good or bad, it's as whether your body can handle it the way it used to. The truth is, milk is a powerful food. It can support bone health, muscle strength, and even immune function. But it can also cause problems when consumed daily in older adults, especially if there are hidden health conditions or digestive changes. So today, we're going to explore what happens in the body when someone drinks milk every day after 60. We'll look at both the benefits and the risks, and we'll help you understand how to make the best choice for your health. First, let's talk about the benefits. Milk is one of the richest sources of calcium, which is essential for strong bones. As we age, bone density naturally decreases and the risk of fractures increases. A daily cup of milk can help supply calcium and vitamin D if fortified, which support bone strength and reduce the risk of osteoporosis. Milk also contains high-quality protein, which helps maintain muscle mass. This is especially important after 60 because muscle loss happens faster with age, and weaker muscles increase the risk of falls. Milk also contains essential nutrients like vitamin B12, potassium, phosphorus, and magnesium. Vitamin B12 is crucial for nerve health and energy, and many older adults have lower B12 absorption. Milk can help fill that gap. Additionally, the hydration and electrolytes in milk can support overall body balance, especially in people who don't drink enough water. But now, let's look at the other side. The risks. One major issue is lactose intolerance, which becomes more common with age. Many people lose the enzyme lactase, which is needed to digest lactose, the sugar in milk. When lactose isn't digested properly, it can cause bloating, gas, diarrhea, and stomach cramps. These symptoms may start to appear after 60, even if milk was fine earlier in life. This is not a sign of weakness, it's simply the body changing. Another concern is inflammation and mucus. Some people notice that milk increases mucus production, worsens allergies, or causes sinus congestion. This can affect breathing, sleep, and overall comfort, especially in older adults who may already have respiratory issues. Now, a very important point is kidney health. As we age, kidney function may decline. Milk contains protein and minerals that require processing by the kidneys. In people with reduced kidney function or kidney disease, drinking milk every day may increase the workload on the kidneys and worsen symptoms like fluid retention or high blood pressure. That's why older adults with kidney issues need to be careful. Another hidden risk is calcium overload if milk is consumed excessively along with supplements. Too much calcium can lead to kidney stones, constipation, and imbalanced mineral levels. Many older adults take calcium supplements thinking it's necessary, and then they also drink milk daily. This combination can become harmful rather than helpful. Now, let us talk about what happens to your heart and blood sugar when you drink milk. Every day after 60, milk contains saturated fat, especially whole milk. Too much saturated fat can raise bad cholesterol, LDL, which increases the risk of heart disease. After 60, the risk of heart problems increases naturally. So, adding daily whole milk can sometimes push cholesterol levels higher. That doesn't mean milk is always bad, it means the type and amount matter. If you choose low-fat or skim milk, you can still get calcium and protein without as much saturated fat. But there's another factor. Milk is often paired with sugar. Many people drink milk with tea, coffee, or cereal, and they add sugar or sweeteners. That extra sugar can raise blood sugar levels and contribute to weight gain and insulin resistance, especially in older adults who may already have prediabetes or diabetes. Another important issue is digestion. Aging slows down digestion and reduces stomach acid. This means food stays longer in the stomach and can cause acidity or heartburn. Milk is often thought to relieve acidity, but for some people, it can actually trigger more acid production after a short relief. So, drinking milk daily can worsen acidity or cause stomach discomfort. Now, let's talk about bone health again, but from another angle. Milk does support bones, but if the body doesn't absorb calcium properly due to low vitamin D or poor digestion, then the benefit is limited. Many older adults have vitamin D deficiency, which reduces calcium absorption. So even if you drink milk daily, if vitamin D is low, the calcium may not be used properly. Another hidden problem is weight gain. Milk has calories, and when consumed daily without adjusting the diet, it can lead to gradual weight gain. After 60, metabolism slows down, and it's easier to gain weight. Extra weight increases the risk of joint pain, diabetes, and heart disease. So milk should be consumed wisely, not as a free drink. Now, let's talk about immunity and inflammation. Milk contains proteins that can trigger mild inflammation in some people, especially those with allergies or autoimmune conditions. This can worsen joint pain, skin problems, and even breathing issues. That's why some older adults feel better when they reduce milk consumption. But milk also contains probiotics in fermented forms like yogurt or kefir. These can support gut health, improve digestion, and strengthen immunity. So the best approach is often to choose fermented dairy instead of plain milk if you want the benefits without the risks. Now, let us talk about the safest way to drink milk after 60 and what alternatives you can use if milk dose and tea suit you. First, the best option is low-fat or skim milk. This reduces saturated fat and protects your heart. You can still get calcium and protein, but with less risk of high cholesterol. If you don't like low-fat milk, then choose milk with 1% fat and limit the amount to 1 glass per day. Second, don't drink milk on an empty stomach. Many people do this because they think it's healthy, but after 60, it can cause acidity and stomach discomfort. It's better to drink milk with food, like breakfast or after a meal. This helps digestion and prevents acid reflux. Third, avoid adding sugar. Sugar is one of the main reasons milk becomes unhealthy. If you drink milk with tea, coffee, or cereal, try to reduce sugar gradually. Use cinnamon or cardamom for flavor instead of sugar. This keeps blood sugar stable and prevents weight gain. Fourth, include vitamin D. Calcium is important, but without vitamin D, your body can't absorb it properly. You can get vitamin D from sunlight, fish, eggs, or supplements. Many older adults need vitamin D supplements, but you should consult a doctor before starting. Now, if you feel bloated, gassy, or uncomfortable after milk, you may have lactose intolerance. This is common after 60. The solution is not to force milk. Choose alternatives like yogurt or kefir, fermented dairy, easier to digest and great for gut health. Almond milk, low calories. Good for heart. Oat milk, good for digestion and fiber. Soy milk, high protein, good for bone health. Coconut milk, lighter but low protein. If you still want the benefits of milk without the side effects, yogurt or kefir is the best choice because they contain probiotics that help digestion and immunity. So, what happens if you drink milk every day after 60? The answer is it depends on how you drink it and how your body reacts. Milk can be a powerful source of calcium, protein, and essential nutrients that support bone strength, muscle health, and immunity. But after 60, our bodies change. Digestion slows down. Lactose intolerance becomes common, and heart risks increase. That means milk can also cause acidity, bloating, weight gain, and high cholesterol if consumed in the wrong way. The good news is that you don't have to avoid milk completely. The key is smart choices. Drink low-fat or skim milk. Limit it to 1 glass per day. Avoid sugar and never drink it on an empty stomach. And if milk causes discomfort, switch to healthier alternatives like yogurt, kefir, or plant-based milk. The most important lesson is this: balance and moderation are everything. Milk is not a must, but it can be a beneficial part of your diet if used correctly. If you want stronger bones, better digestion, and more energy after 60, the best approach is a balanced diet, regular walking, sunlight for vitamin D, and smart food choices, not just drinking milk.